Welcome everybody. Hello and welcome to the live health panel at the KW 2020 virtual Vegfest. My name is Rob McNeil and I am the co-host of the Liberation Now radio show, and I've been asked to moderate an incredible group of health professionals discussing plant-based nutrition and its impact on human health. I'm definitely a junk food vegan and I can already feel my health improving just being in the same Zoom call with these amazing experts. So let's introduce our experts. On our live panel today, we have Dr. Neal Barnard joining us from Washington, D.C., where he is an adjunct associate professor of medicine at the George Washington University School of Medicine and the president of the Physicians Committee for Responsible Medicine. Dr. Barnard is a nutrition researcher, author, and health advocate. In his keynote talk, Dr. Barnard spoke on the surprising effects that foods have on our hormones and our health. If you're looking for more information, please pick up a copy of his latest book called Your Body in Balance. Welcome, Dr. Barnard.
Thank you. Great to be with you.
Awesome. Thanks for being here. Next, we have Dr. Julie Chan, who joins us from Markham and is a plant-based, board-certified naturopathic doctor, registered acupuncturist, and founder of the Liberty Wellness Clinic in Markham. She is a passionate advocate for the climate, environment, and animals, and the founder of Peace for Paws and Animals Asia, Toronto. In her talk, Dr. Chan discussed all the reasons to go plant-based and overcoming common obstacles. Welcome, Dr. Chan.
Thank you.
We also have Dr. Shane Williams, who joins us from Bracebridge at the Williams Cardiology and Wellness Medical Center. Dr. Williams blends a traditional medical practice with an enhanced program of proactive wellness, with a large focus on enabling clients to take charge of their health by providing education on the value of proper nutrition and living well. In his talk, Dr. Williams gave a brief overview of the importance of adapting to a whole foods plant-based diet in an effort to reverse and prevent heart disease and other major illnesses. If you're looking for more information, be sure to sign up for his 6-week online nutritional program at www.williamscardiology.com. Welcome, Dr. Williams.
Thanks for having me.
Awesome to have you all here. Dr. Rikin Patel joins us from Markham. Dr. Patel is a pediatrician and clinical assistant professor in the Department of Pediatrics at the University of Toronto and a plant-based enthusiast. He currently works for the Scarborough Health Network and is a founding member of Markham Kids Clinic, where he actively discusses plant-based nutrition and interventions for children and teenagers. In his talk, Dr. Patel touched on nutrients, vitamins, and minerals that we need to be mindful of when we adopt a plant-based lifestyle. Welcome, Dr. Patel.
Thanks for having me.
This is great. What a brains trust we have right here. This is so exciting for me. I have so many personal questions, but we also have a lot of questions. And thank you, experts, for being here. Just a couple of points about the format today. This is a Zoom call that's streaming on Facebook Live. Questions were received before today, and we probably won't even get through all of them. So I'm sorry. We appreciate any comments and sharing on Facebook, but we won't be able to answer any new questions, most likely. Also, this panel is being recorded and will be up for you to look at later at your leisure. We're going to rotate the questions, one for each expert in turn, starting with our keynote speaker, Dr. Barnard, and then in no particular order, Dr. Chan, Dr. Williams, and Dr. Patel. I'm going to ask our experts to try and keep their answers as brief as possible, 1 or 2 minutes maximum. If we need to go longer, we will. And if any of the other experts want to add comments on somebody's question, please just raise your hand or say something and we'll make space for you. So, without further ado, we'll dive into the questions. Our first question is for Dr. Barnard. And that question is, does soy raise hormone levels in men? How much can you consume? Is it okay to eat soy milk and tofu every day?
What a great question. I'm sure a lot of people have a similar question as they are looking to get away from meat products. As you know, meats and dairy products have cholesterol, they got bad fat in them, so replacing them is a good idea. And the question is soy a good replacement? And the short answer is yes. The most common objection that people raise is they've heard somewhere on the internet that soy increases breast cancer risk in women. It turns out to be the opposite, that many studies have been done on this, and women who consume the most soy have about 30% less breast cancer risk than women who avoid soy. And that's also true after cancer diagnosis. The women who consume the most soy after a breast cancer diagnosis actually have about 30% less mortality. So soy is protective rather than harmful. For men, we see the same, similar benefit regarding prostate cancer. Soy does reduce the risk of prostate cancer, again, by about the same margin. So soy is not harmful. There is no upper limit of soy. That said, we want a variety of foods. Soy is a legume, and that's one of the groups. Vegetables are another, fruit is another, whole grains is another. Keep your nutrients in balance.
Okay, great. Thank you. Thank you for sharing that information. Our next question is for Dr. Chan. We've had a lot of questions on vitamins and supplements and what plant-based adults and children should be taking. Everything from calcium to vitamin D to iron. Could you provide some clarification or resources?
Yes, absolutely. So a lot of patients will ask about, when they move to plant-based, what type of nutrients they need. And a few things that we need to look at, and this is not just for people going plant-based. A lot of my patients who are still eating meat products are already low in these nutrients. So I want to make sure people don't have this misconception that when they go plant-based, that all of a sudden they're deficient in all of these vitamins and minerals. But common ones we get are often vitamin D, B12, iodine. There's also calcium, and sometimes selenium and zinc. And a lot of these can actually be obtained from plant-based foods, but you do have to make sure that you are consuming them. So sometimes, let's say someone is going on to a junk food, vegan diet, then they would be deficient in quite a lot of things. Iron is a big one. But I have to say, though, in my practice, the people who have the lowest iron are surprisingly eating animal-based products. A lot of my plant-based patients, once they start eating whole food plant-based foods, they're consuming small amounts of iron throughout the day in their plant foods, and they're actually absorbing it a lot better. And keep in mind, because iron is better absorbed with vitamin C, plant-based eaters typically do eat a lot more fruits and vegetables, so we do see an increase in iron levels. I'm one of them. When I went vegan, my iron nearly doubled. And my doctor was very surprised when he took a sample because he did not know why my iron had gone up so much. And I said, I just went plant-based. So those are sort of the top nutrients people ask about a lot, but you have to come back to looking at what you're eating. Not everyone needs to take a supplement for every single one of those. If you can get it from your foods, then you can avoid taking a supplement. I would say two of them that often people are not getting enough, though, are B12 and also vitamin D. But this is all across the board in everyone and not just in plant-based eaters.
Very cool. Thank you. Thank you for that.
Can I make a comment, an additional comment about that? I mean, in terms of diagnostics as well, because in terms of the iron deficiency, I've had a few patients who showed with a mild anemia, and the family physician was very quick to point out, well, they're not eating meat. And before I got into this area, a decade ago, I would have fallen into the same trap, thinking that, well, maybe it's a meat deficiency. But on a number of occasions, I've said to the family doctor, please don't blame this on the person's being a plant-based eater. They need to have some more evaluations. And this was a middle-aged man with an anemia of unknown diagnosis, and he later was diagnosed with a mild lymphoma. So on a number of occasions, I often say to people, please, as a diagnostic potential trap, don't blame the anemia on plant-based eating, because I've never seen it in the 10 years I'm at this now.
And you're very right. To add on that is I like to do a panel on patients before they go plant-based and after. And it's incredible because most of the people who, let's say, they think they became anemic after going plant-based were actually already anemic before. And they were already B12 deficient before. But when someone starts to start a new diet, they become hyper-aware and of all the symptoms, right? So you're very right. But doctors are sometimes quick to jump to blaming the plant-based diet.
And of course, that would delay an anemia deficiency and maybe a malignancy that's not detected, so I think it works both ways. Yeah.
Thanks for all that valuable information. Dr. Williams, I keep hearing about heart-healthy oils. Is there such a thing?
That's a very hot topic, of course, and one that's heavily debated by people who are much more intelligent than me. But I mean, in looking at especially the work of Dr. Esselstyn in patients with established cardiovascular disease, I think Esselstyn's work in this area, which recommends a diet that has no added oils, no nuts and seeds added, allowed him to show that he could take established aggressive coronary disease and reverse it. And so for my patients, many of who I see have established coronary disease, I do put that diet as the target diet that we should be aiming for. And in a number of even recent editorials that Esselstyn has written as well, showing that even in other mammals, the addition of nuts and seeds and oils really tends to aggravate vascular disease. So I think a lot of the push now on advertising and media to the latest heart healthy oil, I think is advertising nonsense, and one that is usually justified as often a misinterpretation of some of this observational data. So no, in a snapshot, I don't think there's such thing as a heart healthy oil. And some people will retort back and say, but don't we need oils? Don't we need fats to be healthy? We do, but as Dr. Campbell will say, you know, the foods that in which the oils are contained, the whole foods with as minimal processing as possible, will provide you with the adequate number of oils you need for healthy function. Adding oils is every bit of oil that you add seems to aggravate vascular disease, and the same seems to be true with high blood pressure in my experience, diabetes, obesity, and all of the other metabolic problems that are associated with processed and animal-based food consumption.
Thanks for that.
But I'd be very interested in any of the other experts' opinion on that too, because this is a big topic in an area that sometimes plant-based people may even disagree on.
Any volunteers from our esteemed panel? No?
See, it's like religion. Nobody wants to touch the topic.
Oh, I guess you've cracked the answer there, Dr. Williams. It's now written in stone there.
I'm happy to jump in just to reinforce what Dr. Williams said. I think he's absolutely right. And it's true that we do need traces of oil, but it's a funny thing. If you took a leaf of spinach and you sent it to a laboratory, they would tell you that maybe 7 or 8% of its calories come from natural oils. And you do need those. I mean, you need, this won't be on the test, but you need alpha-linolenic acid and traces of linoleic acid. Those are the essential fatty acids. What we don't need is to concentrate oils and put them in a bottle and pour them all over our foods. If you think about it, an olive tree doesn't have a faucet on it. The oil is all in the olive fruit. And to make olive oil, you have to take 10,000 olives and throw away all the pulp and all the fiber, and you concentrate it. It's kind of the same way as people will take sugar cane and throw away all the fiber and make sugar. And just as you could put a huge amount of sugar, pure sugar, into a soda, you can put a whole lot of refined oil, or even unrefined oil, but just isolated oil, onto a sauce or into other foods. And then you're getting a lot of calories. And even if it's something like olive oil, you're getting a surprising amount of saturated fat. It's nowhere near as bad as chicken fat, and it's not as bad as salmon fat with regard to the saturated fat content. But it's there, and you don't need it.
Thank you.
Okay, thank you. Thank you for that. All right, our next question is for Dr. Patel. Last but definitely not least, it was just a random order, no offense intended. So we have a question from a human who says that they are plant-based and pregnant. Is there anything they need to do to be careful to ensure that their baby is healthy?
Yeah, I think it just builds on what Dr. Chan was saying, was that for moms, I mean, I don't deal specifically with a lot of the prenatal care, but we will talk to moms after I take care of the babies after they're born. But generally speaking, vitamin D, B12, and the omega fatty acids are the most important to have during pregnancy. And then I would say even increasing the intake when breastfeeding as well, and particularly vitamin D. especially when you're in areas where there's not so much natural vitamin D through sunlight. So, and I just forgot to mention iron as well. Those four, I would say, are the most important ones to consider, in addition to just the regular prenatal vitamin.
Okay. Would you say that, I'm not knowledgeable in this area at all, and you're the expert, would you say that those requirements or suggestions are very different to a non-plant-based person?
No, they would be the same in a non-plant-based person. It's just that especially with vitamin or with B12 and vitamin D, where it's found just more easily in animal proteins.
Yeah.
You just have to be a lot more aware that if you're not getting it through the diet, and a lot of them are found in fortified foods, that they need to be supplemented.
Okay. I understood that in the old days there was B12 naturally in the soil, but now they end up kind of augmenting it to animal feed anyway. So in a sense, they just give the animals the B12 and then we eat the animals. So good. Thanks for your answer. It's good to know that plant-based babies can flourish for sure.
Definitely.
My next question is for Dr. Barnard. Someone says that they have no energy during the day, and they're told by their doctor that their cortisol upon waking is low. Is there a natural way to increase that?
Okay. Actually, let me go back to the previous question just really quick, because I think that the answer that you heard is outstanding and really needs to be emphasized and underlined. So many women who are going vegan, when they get pregnant, as every pregnant woman knows, that you are getting an enormous amount of completely unsolicited advice from well-meaning, ill-informed people. And they, in fact, even before you were pregnant, they were wondering how soon you're gonna make this come about, and everyone's intruding on your life. And when you're trying to go vegan and be as healthy as possible, as for yourself, and be good to the planet and kind to animals, everyone wants to butt in and worry about, can you be healthy as a vegan? I would put the question in the other way around. Can you raise a healthy baby who's not vegan? And the answer is you can, but it's so much easier when you don't have the dairy proteins in it and the extra fat and all that junk. And a woman who is trying to maintain an omnivorous diet when she's pregnant, she's eating foods that don't have any fiber in them at all. She's getting a huge amount of saturated fat. Her risk of gestational diabetes is going to be higher. The risk of complications is higher. You can produce a healthy baby, but why not do it on a diet that's loaded with vegetables and fruits and whole grains and beans and doesn't have all this junk in it? So the rules are just what you heard. You do need vegetables, fruits, whole grains, beans, and you do need to pay attention to the nutrients that we're talking about, B12 and iron and so forth. That's really important to do. And not, women shouldn't be a hero and think, I don't ever need prenatals. You do. But a vegan diet is so great. For kids who have vegan parents who raise them that way with a well-planned plant-based diet, you've got great parents. That's a lucky thing to do. Okay, on to low energy. Dr. Chen, I'm sorry, did you want to jump in on that?
Yeah, I just want to jump in because I actually just had the baby 10 months ago. So I wanted to share my experience, just 30 seconds, that I had a full 100% vegan pregnancy. And my son is also fully vegan, and he is developing unbelievably well. Everyone who sees him cannot believe he's vegan, and that's because of his size. So I'm very petite. I'm only 5 feet. He was born about 8 pounds, and he's 10 months old, and he's 24 and a half pounds. And so when you look at him, I mean, he's eating all plants and vegetables. He was just munching on kale yesterday. And I'm just looking at his diet, and I cannot be happier. You know, on the flip side, you know, before I went vegan, how I would have raised him would have been very different. And I don't think he would be as healthy as he is today. So I wanted to add that absolutely a vegan diet is so healthy for the child, for the pregnant woman. And I had a very good pregnancy. So I just want to add my experience. Thank you.
Great.
You know, it's so important. When parents get together, they of course compare milestones in kids. And sometimes parents think, okay, if my kid is growing up really, really fast, So for that's the best, and you can understand, and how parents kind of get competitive because they want their child to do the best. But let's keep in mind what we're trying to do. The idea of parenting is to have a healthy child who hopefully will grow up rather gradually, and be a healthy adult and have a good long lifespan. And when we feed kids animal-based diets, it's surprising the effects that it has. It can as you know, when a child is breastfed, they often grow up a little more slowly and gradually. If they're formula fed, they often gain weight a little fast. And a kid who is raised on an omnivorous diet, a girl is likely to reach puberty earlier, and that may happen for boys too. They are then at higher risk for diseases of midlife, and their lifespan is going to be shorter. So rather than compress the child's lifespan with an unhealthy diet, let's lengthen it out. Let them eat the wonderful healthy foods. Kids who have a mom like you are obviously super, super lucky. Okay, I should not neglect the question that you raised, where the person's got low energy and they're wondering if it has something to do with cortisol. I would not go there. That wouldn't be on my top 300 issues there. What I would do first is talk with the doctor about, is there some other diagnosis? Is there some other issue? When people are tired, sometimes it's obvious things like we're not sleeping, or a person's a little too much caffeinated, or doing a little bit too much alcohol so they're not sleeping well. So those kinds of things can interfere. But there are illnesses that can make people dragged out, like you can have a low thyroid or marginally low thyroid. It's possible to be anemic, although as was said earlier, not super likely on a plant-based diet, but it can happen. So I would see the doctor first and try to see if there's some issue that needs to be dealt with. Apart from that, just a quick word, there was an interesting article just published in the American Journal of Clinical Nutrition, looking at saturated fat, bad fat, which is common in dairy and meat, of course. And the question was, could saturated fat, in addition to its tendency to raise cholesterol, could it also affect your energy level? And so what they did is they looked at individuals who ate a test meal that was high in saturated fat or low in saturated fat. And as you know, saturated fat is the fat in cheese and in bacon and so forth. And what they found is that over the course of the afternoon, after eating a high saturated fat meal, they were cognitively mildly impaired. This is kind of the post-Thanksgiving phenomenon. So in America, we give thanks by being gluttons and taking as much as, we want to thank the world for all the bounty we've had over the past year by taking as much more in as possible. This is our ironic way of celebrating. So you kill a bird and eat a turkey and lots of gravy and lots of other junk, and then people fall asleep watching a football game in the afternoon. And why do they do this? They read on the internet that it has something to do with tryptophan in the turkey. And I have to say that has absolutely nothing to do with it. What has happened is because they've eaten all this grease, their blood is now viscous and thick, and it doesn't flow well, and they don't oxygenate the brain, and they collapse asleep. And after several hours, they will metabolize much of that and return to their former self. But when a person is dragged out, there are often lifestyle and dietary issues that relate to it. And I would investigate those first, and then after that, I would look to see if there's something medical going on.
Thank you for that. Any other comments from our other experts on that, or should we keep going?
I think that's a really important thing to remind people too. And just like in the documentary Game Changers, a visual like that where people again have thought that, oh, I think I just got a turkey coma, or that tryptophan theory. Once you actually show them that no, actually your blood goes from red water to jelly, that grosses enough of people out to make them think, holy shit. So actually my brain is temporarily anoxic actually after I have that meal. So that turkey fatigue I get, my God, that's gross. And I think those little hits with those images of that are truthful, but that are gross, actually maybe play a role in them ultimately making decision, okay, enough's enough. Yeah.
It's a good point. That's a really good point. And it kind of leads into my next question for Dr. Chan, which is a common one that I hear from people all the time. My doctor tells me I need to eat meat or eggs or insert other animal product because of insert health problem. What should I do?
This is a tough one, and I get this a lot. And it's a big challenge because patients generally, they want their doctors on board with them every step of the way. And so when they kind of hit these obstacles, or their doctors are not really agreeing with their dietary changes, they feel discouraged. They start to question if they're doing the right thing. And so there's no easy answer, because I mean, I have had patients who argued with their doctors, who brought research papers to them. Some are very receptive and some simply aren't. This comes back to the individual, is that you really have to take your diet into your hands, because you have to remember, and there's no offense to medical doctors and the medical community, but you know, nutrition is not really part of their training. It's, you know, I always say, go to the person that can help you in that area. There are lots of medical doctors who have a huge interest in nutrition. Find one of those doctors, or a naturopathic doctor, or a dietitian who is trained in plant-based nutrition to help you make this transition. You know, if you visit your regular GP and they start saying, no, you need to eat this, you need to eat this, it does put patients in a difficult spot. And sometimes they just go right back to their regular diet, eating eggs and cheese and meat again. But they'll see that after a year, they're not feeling any better, and they're looking for answers. And these are the type of people that end up in my office, is they're just going round and around, doctor to doctor to doctor. They're not getting the answers. So I have to say is, you know, do you suggest to the patient to go back to work with their doctor, find a new doctor? That's really up to the individual. But I always encourage my patients to read. There are lots of resources online through, you know, even Dr. Barnard's website. You have so much information there. I read your website all the time. I send it to my patients, is to obtain the knowledge yourself, and you have to make decisions yourself as well. I don't know if any of you have good tips on this one, but it's a hard one.
Thank you for that.
I must say that because the science and the evidence is growing so much in this area, that my physician colleagues who aren't as familiar, they'll come to me to become a little bit more educated, because they don't know where to start. And that's completely fair. We all, at least for the physicians, look at kind of the background we've received. So I think definitely the tide is shifting, and especially in the younger generation of physicians coming through. So that's promising. But still the number of, and that's why I mentioned my talk, like a combination of a dietitian and a well-informed physician is the key. And that's not always, I agree, easy to find, but they are available, and I think growing now.
Thank you. Thank you for that. Okay, we will move on, if there's no other takers on that, to Dr. Williams, your next question. The keto diet. The keto diet, love the keto diet, is often seen as the polar opposite of a plant-based diet. What are the health implications of the keto diet to inform future conversations with keto friends and family?
Well, I mean, some of the observational medium-term and long-term data around the long-term effects of people eating a low-carb diet, which is, you know, towards the trend of a ketogenic diet, shows that folks with established coronary disease, and even those who don't, the rate of death, early death, premature death, and recurrent vascular events is raised by 30 to 50%. So I warn people that, again, when they see the latest craze on Facebook or social media, or even what might be advertised to their physicians, and their physicians tell them about this great new ketogenic diet, I remind them that, well, again, you got to look at what your endpoints are. And there is some evidence that taking a ketogenic diet and making your body more acidic and changing your metabolism towards that, the same as if you're on chemotherapy, will help you lose weight. But that's obviously not the end goal. We want you to lose weight and be healthy. So I tend to push back a lot to patients when they come to me saying that their doctor has recommended ketogenic diets. And quite frankly, I also think as more and more legitimate data is being shown that the long-term effects of this eating pattern of ketogenic diets is harmful, that I think it's going to be possibly dangerous for physicians to be recommending such a dietary approach. So that's my 2 cents worth on that. But I'm sure Dr. Barnard and the other experts would know, would be able to comment as well. The trend in ketogenic diets popularity is quite very disturbing, actually.
I agree. I've had, in the last couple years, lots of patients come in feeling very sick from being on the ketogenic diet, and they found me and they said, what's going on? I thought this was good. I lost a ton of weight in the first couple months, and now I'm just losing hair. I'm breaking out. They have terrible gut function. There are so many side effects with the ketogenic diet, and it is very disturbing that it's being suggested to patients. And you're totally right. It's not about losing weight. It's about how long will you live. And if it's going to reduce your lifespan, it's not worth it at all. And so I totally agree with you that I think you have to be very careful when there's these new diets popping up everywhere. And this is the same with the paleo and all these. And the one that I get all the time, and from fellow colleagues of mine who often prescribe this, is the paleo autoimmune diet, which makes no sense to me at all. But this is also a very hot circulating diet that I see. But yeah, I have to be very careful.
Thank you for those answers. I don't think the average life of a caveman was all that long, so I'm not sure how much historical data there would be, but you guys are the experts, and I appreciate that very much. Moving on to Dr. Patel, is there any correlation between diet and behavioral issues in children?
So that is something that people are, still looking into right now. I think overall, most people, at least people who are in pediatrics, we have pretty, suggested guidelines for sugar intake specifically. Specifically because most of the things that kids are eating are usually packaged or like juice and things, that are quite processed. And so we do know that when kids are on, high, specifically sugars, that this can not only just change their, it'll give them a lot of energy, but then there's also an effect of when things wear off, that they are more tired and sluggish in that way. When we talk about other, behavior issues, for example, the topic of ADHD will come up. And, there's been research in the past about food additives, omega fatty acids. And I would say, at least from what I've looked at, the research is suggestive that having greater omega-3 and 6 fatty acids will improve, for example, symptoms of ADHD, but there's nothing clear cut and recommended specifically. But again, in the area of behavior, I think so much outside of just food, I think people, a lot of times a very frequent request that comes through in the office is teachers that have made comments to parents saying that we want my child assessed for ADHD. And I virtually don't, prescribe any medicine to kids pretty much under the age of 8, because most times it's usually kids that it's usually parents just requiring advice around parenting rather than any specific, condition. And a lot of times I have to say, he's a boy, he needs activity, and we need to reduce things, we need to look at things like screen time and other things like that. So I think it's, pinning it to specific dietary things would be very close-minded. And so I try to zoom out and look at the other things going on in the child's life.
Thank you for that. That's good to know. My next question would be for Dr. Barnard. And someone wants to know, Dr. Barnard, if you have any suggestions for giving up cheese.
First of all, let me congratulate the person who asked the question, because getting away from cheese is a great idea. It's in our research studies, when we bring people in to help them with their diabetes or whatever it might be, and we put them on a vegan diet, the one food that they really kind of crave over a longer period of time, it's not meat, it's cheese. And yet it's something that's so great to get away from, because it's loaded with bad fat, it's got cholesterol, it's really high in salt, it's higher in salt than potato chips are. So it's a great thing to get away from. How do you get away from it? The first thing, I think thing number one is it might be useful to know that there are good substitutes for it. If you're having cheese on a pizza, go to the health food store and get some nutritional yeast and sprinkle that on your pizza instead of the cheese. It has a cheesy flavor, got no fat in it. There are vegan cheeses out there. If you use those, I would use that as a party food or a transition food. I wouldn't stick with them for the long run, just because they're better than cow's milk cheese, but they're in that they don't have cholesterol, and they're typically lower in saturated fat, but they're not as healthful as a more whole food diet. Cheese is addicting. It has what are called casomorphins in it. These are the casein protein in milk and in cheese products breaks down to release opiate compounds that attach to the same receptor in the brain that heroin attaches to. They're just not as strong. It's about 1/10 the brain binding power compared to pharmacy grade morphine. So it's strong enough to keep you hooked, not strong enough to get you arrested. But it's real, and that's why people tend to get hooked on cheese, we believe. I think the best way to get unhooked from cheese, if you don't mind my saying so, is to truly understand where it came from and to keep that image in your mind. Now, I'm a doctor, I'm not an ethicist, I'm not a philosopher, but when I wrote my book called The Cheese Trap and I looked into what the animals go through, I found it the most motivating thing. And if you don't mind, I'm gonna give you 30 seconds of reality. The only way you get a cow to produce milk is an underpaid farmhand takes his left hand and puts a glove all the way up to his shoulder and inserts it into the cow's rectum. And if you jam your arm in up to about your elbow, you can feel through the rectal wall the uterus of the cow, which you then hold still with your left hand. With your right hand, you take what looks like a big long knitting needle and jam it through the cow's cervix and insert semen that you took from a bull. Now, these animals are not going to object because she is chained by the neck and she's going to get impregnated whether she wants to or not. She obviously doesn't want you doing this, but she's stuck. And she will be then pregnant for 9 months. During that time, she will be milked during much of that time. So her estrogens and so forth are getting in the milk and you're drinking that, and that's goofing up your physiology. At the end of 9 months, she will give birth to a calf. And at that point, all the farmhands gather around because it's a beautiful thing to see this little awkward calf stumble to her feet and look at her mom, and her mom looks at her, and the mom kind of tries to lick her a little bit and welcome her into this world. At which point a wheelbarrow comes around the corner and somebody takes that calf, her baby, and sticks this awkward calf in a wheelbarrow and starts walking away. And there's no bond in nature stronger than the mother-infant bond. And so she will follow and try to get her baby back, and then a gate will be slammed in her face, and then all night long she'll be crying, as will her baby, who is raised in isolation. If the baby is a male, the baby will be killed for veal. If the baby is female, she will be left in complete isolation until she's old enough to have somebody's hand up her backside, and she'll be impregnated. And then all of them are dead, not at age 20, which is the normal lifespan of a cow, but about age 4, which is the age when they're no longer producing enough milk to justify their continued existence. So the next time you're having a grilled cheese sandwich or a glass of milk or a bowl of ice cream, remember that the mother cow's baby was taken away and ultimately killed, and she was killed in what is effectively a meat industry, because all dairy cows become hamburger. But it's just before she's killed, she has to go through this 3 or 4 times, and then they're gonna kill her. So again, I'm a doctor, I'm not an ethicist, but I have always felt that ethics have to be the foundation of everything that we do in medicine and hopefully in life too. And if we remember some of the things that we're doing to despoil our earth or to harm animals, that should be a motivator for us as well.
Wow. Thank you so much for that graphic but very important description. That is definitely the reason that I'll never eat animal-based cheeses, although plant-based cheeses can be quite delicious as well. But thank you for sharing that with us. Does anybody else have any comments on cheese, or should we
Best
keep?
answer I've ever heard of: should you eat meat or should you drink milk? Hard to argue that one, isn't it?
It sure is. Okay, well, it was a tough act to follow, but Dr. Chan, we have a question from someone here that says that they can't have legumes or grains. Can they meet all the necessary protein, amino acids, getting protein from nuts and seeds and veggies alone?
So I'll first say that if someone comes to me, and I do have patients with lots of food issues where they can't eat legumes and they can't eat grains, the first thing I would do is do an assessment as to why that's the case, because usually there is some serious underlying health issue. There's something off with their physiology, their gut function. Often there's leaky gut. There's a ton of food sensitivities. Possibly, you know, they've just eaten so many foods like dairy and cheese that have ruined their gut physiology that they're not able to eat simple foods like a grain. So, you know, for me, it's always looking at the root issue. And as to why this patient is not able to eat those things, because those are very important nutrients and food groups that need to be part of a plant-based diet, in my opinion, because if you were to only focus on eating seeds and nuts for protein, you're going to be looking at an extremely high-fat diet. So to be able to get enough, I mean, there are lots of protein in broccoli and in other plant foods. But it will have to be much more well-planned, and for sure the nut intake will be quite a bit higher than someone who is able to eat legumes and grains, right? Because if you look at a cup of millet or a cup of quinoa, there's already 8 to 10 grams of protein there. So, you know, whole food grains have so much protein in them. And so, you know, number one is looking at why. I would love to work with these type of people with helping them with their digestion, but it's also the forms too. I've had lots of patients who say they cannot eat it, but I ask them to try organic sprouted versions of certain types of grains or beans, and they actually can digest it. So, I mean, it's not a very easy answer again, but the question was, can they get all of their nutrients? I would say it wouldn't be very balanced, and it may be difficult to get all their amino acids just from seeds and nuts. I don't know if any of you agree with me, but I would think it would be a very high fat diet as well, because they would need to consume quite a bit.
Thank you. Any comments from the grandstand? Other experts?
I would just, agree with that variety is key to, because the different plant proteins have different amounts of essential amino acids, which is, I think, a big thing to focus on, but that variety is the key to complement. So finding out why, and, I find that a lot of times people will say they have allergies to things, and when you dig a little, it's not really an allergy, or they haven't had any allergy testing.
Okay, thank you for that. Thanks a lot. Okay, moving on to Dr. Williams. Question is, all the men in my family die in their early 40s of heart problems. Is there anything I can do, or is it all in the genes?
We take out for the basic 6 to 8 risk factors, for heart disease, which include, cholesterol, elevated cholesterol, smoking, fruit and vegetable consumption, activity, and so forth. About 8 of those standard traditional risk factors account for about 90% of risk. So there is a remaining 5 to 8% maybe of risk that are not accounted for from basic traditional risk factors. And so if there is a family history of most people in the family have heart disease, my first mind thought goes to, well, yeah, that's, you inherited your eating habits from your parents, and if they're unhealthy eating habits, and then you inherited risk as well. But I think there definitely is data to support that a family history is an independent risk factor that contributes. But like I say to people, within that elevated risk above somebody without a family history, you can make your chances, you can hedge your bets, if you will, higher or lower based on the remaining majority of the risk, which are often the traditional risk factors. Don't smoke, eating a healthy diet, getting regular exercise, and managing your stress. So I think in some people's thinking, as I'm sure we've all seen, there's this black and white thinking that, oh, I got heart disease and because it's in my family. And then that sort of becomes sort of a warrant and an excuse then to sort of the hell with my efforts to change, ironically, the bigger risk factors and just bring on the hamburgers because heart disease is all through my family. So what can I do about it? And so we try to address some of those cognitive distortions of black and white thinking when people come to me posed with those questions and say, it's not good that, a large number of your relatives had heart disease, but it's not the end all and be all. And it may account for a very small variable of risk for you. And you need to focus on the major things which you can control and which turn out to be the lion's share of the risk of whether or not, which will predict if you die or have a vascular event. So family history matters, but it's only a contributing factor, and it's almost certainly a small contributing factor.
Thank you for that. That's really a really important perspective from an expert. Dr. Patel, we have a question here. I'm not sure if it's exactly in your wheelhouse, but is pea protein safe? We hear a lot about pea protein these days. Is it safe?
From everything I know of pea protein, it has all the 9 essential amino acids. I know it has maybe a little bit less of methionine, but otherwise, I have no reason not to tell people to take specifically pea protein. I'm not sure if anyone else has anything else to add specifically, but as far as I know, it's a good choice as a plant-based protein.
And this is not something I'm strong in terms of pea proteins and various protein amino acid variations, but I think it's a complete protein in my understanding. The problem is when pea protein hangs out in a Beyond Meat burger when the 70% of the calories are contributed from fat. So pea protein may be an innocent bystander, but the friends that it hangs out with are concerning to me. And as I'm sure to all of you, if a lot of people switch to fake meats and think that that's a destination food, which of course we encourage people not to think that way.
Thank you. No, thank you for that very much. Okay, so we've done the rounds a few times. We just have a few minutes left. I guess I'd just like to throw out a question to anyone that would like to answer it. This was suggested by Dr. Chan earlier. What kind of conditions have we seen improve as a result of adopting a plant-based diet in general, plant-based nutrition? And Dr. Chan, if you would like to go first.
Sure, yes. So I had the pleasure in my job to work with patients that have chronic illness, and a lot of them may not have a disease yet. So, they're, again, going round and around trying to figure out why they're feeling so lousy every day, why they're feeling tired, and they end up seeing me. And often we work on their diet. That's always the first thing I look at is, work through their nutrition, making sure they're getting all their nutrients. A lot of them have adopted a more plant-based diet or even gone completely vegan, which is fantastic. And I've seen some expected but very surprising results. I mean, just a few that I can think off the top of my head is things like colitis, ulcerative colitis. I've had many cases where patients have gone into remission and they came being violently ill, going to the bathroom 6 to 8 times a day on multiple immunosuppressants, and just changing their diet has helped them tremendously. Things like allergies have improved because, as we know, dairy can really worsen allergy symptoms. Cheese. I've also had asthmatic patients breathe better. Recently, I had one patient who is on the spectrum, and the moment they turned vegan, they noticed that the child's sleep had improved at least 50 to 80%. No supplements, nothing, just a change of diet. So, Dr. Patel, I think you were talking behavior. I've definitely seen an improvement with those people who have gone plant-based with behavior in terms of ADHD, just kids being less hyper, just being happier kids, less mood swings. And of course, there's the whole list of chronic diseases that we know can be benefit from plant-based diet, like diabetes and so forth. So, you know, definitely have seen lowering of cholesterol, BMI, weight, and so forth. So it's fabulous. I mean, it's not. A lot of people say it's not for me. I don't, you know, I am not ready to do that. I said, that's okay. I mean, just start introducing plant-based meals a few times a week. Like, even if it's once or twice a week, start investigating and trying. I said, there's no harm in trying, because, you know, why are they here to see me? It's because they're not feeling well. So, I mean, there's nothing to lose to start trying to cook some meals, and they usually come back feeling a lot better, and they're surprised. So, you know, that's why I make it a big part of my visits, to spend time to really understand what people are eating and helping them, you know, move forward and make changes.
Thank you for that. Do we have any other input from our esteemed guests?
I'm routinely amazed by how many people improve on symptoms and their overall energy in ways that as Dr. Chan says, that wasn't previously diagnosed. I mean, so many people too who didn't know they had lactose intolerance until they got off the dairy, and then they thought that kind of cramping and abdominal pain was just the normal thing, or maybe something they inherited. So apart from the usual diabetes reversal that Dr. Barnard has studied so much, see this all the time: blood pressure normalization, weight reductions, improvement in angina, and so forth, but improvements in many other things. Another big area is chronic pain and arthritis. Again, an area where people come to me with diabetes and heart disease, see the predicted improvements, and then say, hey, by the way, I'm not using over-the-counter painkillers now for my arthritis that I thought was just a part of getting old. And it was, I thought, as Dr. Barnard says in his TED Talk, I thought it was a one-way street. You know, I didn't think there was any possible improvement for that. And yet now the nighttime inflammation allows me to avoid many of these over-the-counter painkillers themselves, which could aggravate blood pressure and be toxic as well. So it literally is a gift that keeps on giving and improves patients in ways you can't even predict upstream when you identify the standard things that you know are going to improve. So it really is extraordinary approach.
Thank you for that.
I'd say I agree with Dr. Chan and Dr. Williams on what they've said, and I would add one other thing that was really a shocker to me. I started using a plant-based diet for women who had menstrual cramps, and I did this just as a complete guess, because there was no research on it whatsoever, really. But my phone rang, and it was a young woman who said, I can't get out of bed. And so I thought, well, I can give you some heavy-duty bazooka-type painkillers for the next 2 days, but how do we stop this in the future? And so I suggested a vegan diet without added oils, and it was a complete cure for her. And so, meaning her period would arrive month after month without pain for the first time in her life. So I did a randomized trial on this and found that, in fact, it works. And the reason it works is that menstrual pain is caused by estrogens that are too high of levels or too active, and they end up either changing the endometrial development every month so that you have too much endometrial thickening, or you can have a condition called endometriosis, where you have cells implanting all around the abdomen of endometrial tissue that grow and bleed and make you feel rotten. And so if you can reduce estrogen production and estrogen levels, you're going to do better. A high fiber, low fat diet and dairy-free diet does exactly that. And this was pioneered not for menstrual cramps, because menstrual pain is miserable, but it won't kill you. But breast cancer can kill you. And so researchers have been looking into the same mechanism. If I can use a plant-based diet to bring estrogen down and feel better now, then maybe that means I'll be less likely to get breast cancer later. And all that seems to be true. But I have to say there's really two parts of it. Getting away from the animal products is part, but keeping oils scrupulously low for many women also seems to be the other piece of it. So that if every day is a guacamole fest with a lot of greasy stuff, they don't do as well as if they avoid the animal products and the oils. And I wouldn't ask anyone to take this on faith, but if you have endometriosis, if you have just menstrual pain month after month after month, and for that matter, any other hormonal issues like PCOS or even hormone-related cancers. In addition to whatever other treatments you may be getting and whatever monitoring you're getting from your care team, try these two things. No animal products at all, and keeping oils really low. And follow it in a smart way, take your B12 and so forth. But just see, for so many people, their life is just transformed, and it goes into fertility and all kinds of other things. So I got so excited about it. So my most recent book is all about hormones, which is the last thing I thought I was ever going to write about, but it's called Your Body in Balance, and it's how to get your hormones, instead of being too little or too much, get them right back where nature had in mind.
Thank you for that. Thank you.
One more thing I'll just add, which comes up a lot in pediatrics, and although it's not connected specifically to requiring specifically a plant-based diet, I do use constipation, which is very common in kids, as a way to advocate for more of a plant-based diet, because virtually after kids have been cleaned out, a plant-based diet can cure constipation permanently, which also will improve their behavior.
Oh, thank you for that as well. Okay, I think we're basically out of time. So unless anyone has any last minute comments, I just wanted to thank you all so much for being here. I've learned so much, and I hope our viewers have as well. I know you're all busy people, so thank you so much for taking the time to be on the panel today.
Thank you. Thank you, everyone.
Thank you.